Okay. Hello and welcome to NIA. We're so glad that you can join us today. My name is Muzamil. I'm here with my friend Ibrahim, and together we started NIA. We're both passionate about raising awareness about diabetes, along with the high price of insulin in the USA, and we created this organization as a way to promote awareness about this issue. In each interview, we normally discuss various aspects of diabetes, such as tips for managing the condition, and also discuss various aspects of diabetes, such as tips for managing the condition and also personal stories from ourselves to our listeners. We hope that by sharing our knowledge we hope that by you sharing your knowledge and insights, we can help others who are living with diabetes, as well as those who are looking to prevent or manage the condition can also help themselves as well. Thank you for joining us today, Dr. Quint. And without further ado, I'll let my friend Ibrahim ask you the questions.
Okay, so hello, my name is Ibrahim, and yeah, let's get started. So, Dr. Quinn, the first question is, what is the main field you work in?
I'm a doctor and I work in primary care at a federally qualified community health center.
Oh, that's okay. So, what is the most prevalent thing you see in your encounters with patients as a whole?
Well, probably, I see a lot of chronic disease. So in general, the answer is chronic diseases. And I don't know which is number one, diabetes or high blood pressure. But I see a lot of diabetes and I see a lot of high blood pressure. So I would say those are the top two. I'm not quite sure which one is higher than the other.
Oh, okay. Chronic diseases. What is your experience with diabetic patients?
So I treat a lot of diabetic patients. Most of my patients that I treat with diabetes have type 2 diabetes. I have treated type 1 diabetics as well, but far fewer. And I would say I see in an average day, I probably treat at least 4 or 5 diabetic patients a day.
Oh, I see. How do you think diabetes impacts their mental state and thinking?
Impacts their mental state?
Yeah, like how they think, or could it impact their mental state and like how they think?
I mean, in the long term, it can. There is a type of dementia that is seen with diabetics, usually when they get quite a bit older. So I guess if someone has diabetes and the diabetes is poorly controlled, so their blood sugars are very high, that can cause people to be very tired and kind of have poor concentration because they feel kind of sick. They feel they have to urinate excessively. They have low energy, and they may have some problems with concentration because of the fatigue. And of course, it can be anxiety provoking to have diabetes, and especially if you're having trouble controlling your diabetes, that can cause people to feel very anxious.
Oh, okay. So what would you say would be like the best diabetic blood range, blood reading range, like in diabetics?
Well, the goal is that a fasting blood sugar, fasting is nothing to eat or drink for at least 8 hours. So typically, when you wake up in the morning before you eat breakfast or have your cup of coffee or whatever, that's usually a fasting level, unless you've gotten up in the middle of the night to have a snack. So assuming that that's really fasting, the goal is for that blood sugar to be between 80 to 130.
Oh,
And then if you check a blood sugar 2 hours after a meal, you would like it, the goal, the American Diabetes Association has these goals. The goal is to keep it less than 180. And then random blood sugars are harder. Like if you have something to eat and then 5 minutes later check your blood sugar, it's going to be really high. That's not something we really look at because it's so variable. So usually we focus on the fasting blood sugars and the blood sugars 2 hours after meals.
okay. So have you worked with other diabetic patients before? I mean, specialists before, diabetic specialists?
I consult with specialists from time to time. So sometimes if people have really difficult to control diabetes for various reasons, then I will refer that person to a diabetic specialist to take care of their diabetes. I don't do that a lot for type 2 diabetes. I have a few. I mean, I definitely do it from time to time. Type 1 diabetes, especially if they're kids, I have a lot less experience with that. So usually I will refer that person to a specialist. And then sometimes I have, just sent emails or phone calls or texts to diabetic specialists just to ask a question about a particular patient and, whether I'm doing the right thing with them or if they have any advice for medication dosage or something like that.
Okay. And like, would you say that there are a lot of diabetic specialists? In terms of numbers? Oh, sorry.
I don't really know. I don't think there's any problem here in Columbia with the number of diabetic specialists. I don't have any problem when I need to get a patient into a diabetic specialist. Like if I'm making a referral to a diabetes specialist, I usually don't have a big problem getting my patients in. So it isn't something I've paid too much attention to. I don't really know what the numbers are, but and my experience is just here in Columbia, Missouri. So I really don't have any idea if there's a problem with the number of diabetic specialists outside of Columbia, Missouri. But here in Columbia, I don't think it's a problem.
Okay. So now I'm kind of gonna shift to like the the equipment based question. What what future technologies do you predict would be founded in the future to help diabetic patients?
Well, I haven't really read very much about the far future, like what's coming.
Okay.
I think that there's different types of diabetics. There's this type 1 and type 2. Type 1 diabetics always need insulin. Many type 2 diabetics need insulin. So for people needing insulin, there's been a revolution in sensing blood glucose. You've probably heard of these continuous glucose monitors that are relatively in the last few years. And I imagine that they're going to continue to improve so that, right now, I think it's already happening that you can wear a sensor and have an insulin pump, and the sensor tells the insulin pump how much insulin to give. I think that's already happening. If it's not, I would imagine that can't be too far away. So that's for diabetics who are on insulin. For diabetics who are not on insulin, I'm not really up on the latest as far as like medication advances that are coming. Yeah, I'm not really sure.
Okay. But we definitely have improved like maybe since 25 years.
Yeah, I mean, in the last, oh, yes. I mean, I started practicing medicine in 1989. So since I started practicing medicine, when I started practicing medicine in 1989, we only had synthetic insulin, like insulin from, I think it was from pigs,
Pig. Oh,
porcine insulin. We didn't have human insulin really. It was close. And they had, so I mean, since I started, they've got, synthesized human insulin that's identical, it's bioidentical to real human insulin. And they've got insulin that lasts a lot longer. When I started, the longest acting insulin they had was about no more than 12 hours. And now you've got insulins that last 24 to 36 hours. You've got shorter acting insulins. And you've got this, again, this revolution in monitoring where you can monitor continuously now instead of having to stick your finger every time you want a blood sugar. You can have a device that sticks to your skin and then just can give you continuous readings.
oh, yeah, that's great to hear. Okay, Mozamel, do you have any questions?
Well, I guess I did have just maybe one or two, but is there any advice you give people who are currently managing diabetes on how they can better manage diabetes effectively and also affordably?
So, I mean, there's, like everything we do in medicine, I think you can divide treatment up into kind of two broad categories. There's lifestyle changes or lifestyle modification, or behavioral changes, behavioral modification, and then there's medication. So on the lifestyle and behavioral side, the recommendations are, I think, just to back up for a second, diabetes is the main cause of heart disease in the United States, or one of the main causes, along with cigarette smoking and high blood pressure. And so I try to educate people with diabetes that the reason diabetes is such a problem, the reason it's such a bad disease for most people, is that it is so it is so prevalent in diabetics that they eventually get heart disease. So diabetes causes damage to blood vessels, which in turn leads to heart attacks and strokes. So one of the big things diabetics have to understand is that they're at really, really high risk for heart attacks and strokes. The main reason why diabetics have a shorter lifespan than people who don't have diabetes is heart disease and strokes. Also kidney disease. But that also is actually mostly a cardiovascular issue. It's damage to the blood vessels in the kidney. So to, at the risk of oversimplifying, I try to make sure diabetic patients understand diabetes damages your blood vessels. And when you get damaged blood vessels, depending on where those blood vessels are, you're at high risk for heart attack, stroke, and kidney disease.
Mm-hmm.
And those are the main reasons why diabetic patients die early. So when you treat diabetes, you want to, you guys still there?
Yeah, I'm still there.
Okay, sorry, my screen went blank for a second. So when you think about the lifestyle stuff for diabetes, you really want to focus on preventing heart attack, stroke, kidney disease. You want to prevent cardiovascular disease, atherosclerosis. And so quitting smoking, if people smoke, that's like one of the number one things. Like diabetes and smoking is a horrible combination. It really accelerates atherosclerosis. So if people smoke and have diabetes, I'm constantly harassing them to stop smoking. Secondly, diabetics do better when they have a routine. So if you have like a good kind of regular routine schedule, like you eat around the same time every day. You eat breakfast, lunch, supper, or if you only eat 2 meals a day, breakfast and supper, you eat them around the same time every day. And you try to avoid wide fluctuations in how much you eat and then when you eat. You know, diabetics have a hard time if they have unexpected snacks, or if they eat really late at, like a snack late at night, or if they get up in the middle of the night and eat something. They do much better on a routine. So trying to kind of have a regular routine where you eat a similar amount of food at each meal around the same time of day every day really helps. Secondly, really minimizing processed food. Processed food is really, you know, being recognized as one of the major contributors to health problems in the United States. So processed food has too much salt in it, which raises your blood pressure. Processed food has too much fat in it, which causes weight gain. And so trying to get people to, as well as they can, eat fresh fruits and vegetables, lean meats, whole grains. And that becomes a cost issue because, you know, getting fresh food, fresh fruits and vegetables, that's more expensive.
Exactly.
And then the last thing is exercise. That it's really important to get some exercise in daily or almost every day. You know, ideally 30 minutes, 5 to 6 days a week of aerobic exercise. And that actually, exercise itself helps your body utilize insulin, or utilize glucose rather, more efficiently. So your whole system for managing, for metabolizing sugar is more efficient if you exercise every day. People who don't exercise have less efficient utilization of glucose, and they have higher blood sugar levels. So it's a healthy diet, a regular diet, and exercise, and avoiding bad habits like smoking. Those are the things I really push for people to help take care of their diabetes better.
I see. Okay. Thank you. We thank you for joining us today, Dr. Quint. And yeah, we're really grateful we had this opportunity to get to talk to you about this issue. Thank you for joining us today.
Happy to help. Can I ask you a quick question?
Yeah, for sure.
You made a reference to your listeners. Do you guys have a blog?
Well, we normally post our interviews onto YouTube, and whoever watches it there, we consider them our listeners, basically.
Oh, okay.
Yeah.
Tell me what NIA stands for again.
National Insulin Awareness.
Okay.
Yeah.
So and there's one last thing I wouldn't mind throwing out there, is that because we're a community health center, we have access to lower prices for medications. So our patients, like my patients with diabetes who take insulin, can get insulin a lot cheaper because we're a community health center, and the federal government has a program called a 340B program that lowers the price of medications for people. So if I write a prescription for insulin and they go to a 340B drugstore and use the 340B program, which they can do if the prescription comes from a doctor from a community health center like us, they can get insulin very, very reasonably. Like, they can get all their insulin for usually less than $30 a month.
Oh, wow.
Sometimes less than $20 a month. So there's a big advantage. Although I know that insulin prices have become very, very high, and that's affected my patients, we do have some ways around that to help lower the cost for people and make it more affordable.
I see. Well, that's like really good. I'm actually glad. I didn't know that even existed. But yeah, that can like significantly help people who are like underserved currently.
The 340B program is a federal program that's available to what are referred to as safety net clinics. So because we're a federally qualified community health center, we're a safety net clinic. And there are other clinics that are identified as safety net clinics throughout the country, and they can utilize this 340B. And, you know, blood pressure medicines, diabetes medicines, all kinds of medicines. You can't get any medicine. Like, it's not that every single medicine is available, but they'll usually select one particular long-acting insulin and say, this is the one that we'll give you a discount on, or one particular short-acting insulin. Or, you know, there's actually a lot of new medications now for diabetes that are not insulin. Some of them are pills, some of them are injections. They work on other parts of the metabolic system. And those two now are becoming available for this 340B at pretty reasonable prices. And then the other thing we have is we have a full-time social worker who works with the drug companies to get free medication for people who qualify. So people who are low income and don't have insurance, they can get most types of insulin, most types of diabetic drugs for free from the drug companies, as long as they prove that they don't have insurance and they have a low income enough. So that's another way we can get people who have trouble affording their medicine to get their medication. And we're about to enter into a partnership with the food bank here in Missouri, in Columbia. We're going to open up a little clinic in the Central Food Pantry in about a year. But the food bank also is working on obtaining and providing better food for people with diabetes. They've got a program they're starting. I think they may have already started it, but they're working on expanding it where they can provide. So when people who need food go to the food bank to get free food, they're trying to make that food healthier and more designed for patients with chronic diseases like diabetes. So that should also help the issue of people who can't afford to get healthy food.
I see.
That's
Yeah,
awesome.
that is really awesome, and it's really good to know that there are stuff happening that can help people who cannot afford regular food, who cannot afford food that aren't processed, and also like suffering from diabetes. It's good to know that there are people out there helping them, like looking out for them. It's really good to know.
Subsidized.
Yeah, we thank you for your time, Dr. Quint, and we hope you have a good day.
Okay, well, thank you. You guys are doing a great job. Good luck.
Thank you.
Thank you.
Good.
Okay.